First item on the agenda, information papers issued since our last meeting. CB brackets 2532, administrative guidelines on best practices on building management. And the second paper is a letter dated the 11th of January from Mr. IP Kin-yuen at CB brackets 2608. Members, please take note. Any questions? All right. Let's move on to item number 2. Items for discussion at the next meeting. List of outstanding items and list of follow-up actions. The next item will be held on the 25th of February at 8:30 a.m. The government proposed 2 items for discussion, including Hoi Shun Park Extension, To Kwa Wan, and promotional activities of the 10th anniversary of inscription of Cantonese opera onto UNESCO's representative list of the intangible cultural heritage of humanity. Any comments from members? Ms. Tanya Chen. Thank you. On the list of outstanding items for discussion, there's no item on private clubs. I wonder when the government will provide an update on their consultation exercise, and hopefully we can add this into the list. The government should be reporting their progress. The 2 proposed items should not take a lot of time, so I wonder whether this is possible. If the government is able to compile a report, the item should be discussed at the next meeting. This is not about this is not only about the operation of private clubs, but it involves other aspects as well. We will reflect your view to the administration. Any other suggestions? Deputy Chairman, Ms. Au. I agree with Ms. Chen that both items at the next meeting should not take a lot of time. So barring any objection from member, we can introduce an extra item. All right, item number 3, the Community Care Fund. Papers have been circulated with members, and we have 2 papers, 678 brackets 03 and brackets 04. We welcome the administration. Dr. Law Chi Kwong, Secretary for Labor and Welfare. Mr. Patrick Lee, Deputy Secretary for Home Affairs. Ms. Carmen Kong, Principal Assistant Secretary for Home Affairs. Ms. Mei Chan, Deputy Secretary for Education. Mr. Chen Nap Ming from the THB and Mr. Norris Young from the THB. Ms. Peng Kidling, Assistant Director from the SWD, and Dr. Tony Ko from the Hospital Authority. We first invite Dr. Law Chi Kwong, Chairperson of the CCF Task Force under the Commission on Poverty, to walk us through the paper. Thank you, Chairman. Papers have been circulated, so I would highlight some of the points. Since the establishment of CCF, 47 assistant programs have been launched, and 11 have been regularized. As for the Dementia Community Support Scheme, it provides support to dementia patients, and starting from early next year, it would be made regular as well. In other words, there will be 13 regular programs under the CCF. In June last year, we briefed the panel on the work progress of the CCP, including the implementation of the subsidy to purchase and construct modular housing as a pilot scheme, as well as the provision of subsidy to needy primary and secondary students for purchasing mobile computer devices to facilitate e-learning. Through the COP, The CCF has endorsed and enhanced certain programs. Under the Elderly Dental Assistance Program, it has been extended to cover elderly persons aged 65 or above and receiving old age living allowance. As for the cervical cancer vaccination pilot scheme, this scheme will be extended by 6 months to ensure interface with another vaccination scheme. As for the CCF medical assistance programs, 7 new specified self-financed cancer drugs, as well as one for medical device has been introduced. We have enhanced the vetting mechanism on the enhancement of calculation of patients' annual disposable financial resources. So I would stop here, and questions are welcome. Thank you, Secretary. Mr. Siu Ka-fai, Mr. Mark Fong Kwok, Mr. Siu Ka-shun, Mr. Yu Siu-ing, Mr. Vincent Chang, and Mr. Roy Kwong, and Mr. Odin Chow, Dr. Fernando Chang. 4 minutes each, including question and answer. Mr. Peter Shiu. Thank you, Chairman. According to paragraph 10 of the paper, as of the end of December last year, the balance of the CCF stood at about $19.759 billion, including $17.821 billion at the HKMA and bank deposits of around $1.9 billion, and total investment return being $4.568 billion. I'd like to know what the total investment return means. The majority of the balance is placed at the HKMA, so the total investment return refers to interests at the HKMA, and we also have interest from time deposits. So first of all, I'd like to thank the HKMA for achieving the investment return of $4.5 billion for the people of Hong Kong. At the council meeting last week, we approved a motion to help patients who need ultra-expensive drugs, and the resolution stipulates, according to the resolution, how much will the government do under the CCF and how much will be spent. The Secretary for Food and Health addressed the relevant questions that day. Within the ambit of the CCF or the pilot schemes, we currently have a current program to cover ultra expensive drugs, and most of them apply to rare disease patients. When the HA decides there are suitable drugs for rare disease patients, well, we do not have a lot of these drugs currently because they are for rare diseases. So I would defer to Dr. Ko. The speaker is not the microphone. Dr. Ko. Good morning. Thank you. Like the Secretary said, when the HA tests new drugs every year, we would propose the CCF to incorporate certain drugs every year, and these include the ultra-expensive drugs as well as rare disease drugs. When we see an appropriate drug, we would propose to the CCF to include it. How many patients are covered and what is the annual cost? It depends on the specific drug, but when we talk about ultra expensive drugs, treatment typically amounts to a few $1 million every year. But like we said, the number of patients is relatively low, so the subsidy amount per person is relatively high. Let me cite an example. In the last year, the CCF approved the treatment of an SMA patient, and about 20 patients can benefit. This amounts to a cost of about $70 million. How many such patients are there in Hong Kong, and what is the estimated cost? We do not have such figure. And for many rare diseases, different treatments are needed. Some treatments are more expensive than others, and not all of them require support from the CCF. For patients that require special treatment or expensive treatment, we would propose to the CCF task force.
So I'd like you to find out about the amount of people involved and the budget so that we know what preparations need to be made. Ma Feng Kwok next. Thank you, Chairman. Paper mentions that for the elderly dental assistance program, which has been on for 7 years, and now you're proposing to renew it for 3 years from this year onwards. By that, it will be 10 years. It shows that there's a need for it. Has the government considered making it a regular assistance program? And the government also said that you will review. HA will have a review of it, and it's supposed to be finished in 2018. So what's happened? Chairman, for this program, I think the main constraint is that it's about the number of dentists. So why has it been on for so long? And it's because for elderly people who are aged 80 and who are eligible, now the eligibility age will be lowered to 65. So we need to assess the demand throughout the years and the supply of services. I believe in the next couple of years, before this program comes to an end, the Food and Health Bureau will make a proposal based on the review. So in other words, the government acknowledges the need for this program. It's just that because of supply of dentists, limited supply, and that's why you use the community care fund to sustain it. If that's the case, well, the program has been on for 7 years. You must have done a lot already. I mean, like for dentists, you would have trained quite a number of them by now. So what is the reason for not actually perpetuating the program? Well, actually, in providing dentures, the government really doesn't have much information on the demand yet. So we need to be cautious in the beginning. So that's why we lowered the age over the years from 80 to 65. Not everyone needs to have the denture. So therefore now if we are to push the age back to 65, we think that after some time we will be able to assess the demand even better. Those who are elderly, who are age 69 or above, how many of them can have actually have the denture needed? I think it takes time for us to know the exact demand. We're just making guesses now. I don't quite accept your explanation, because if you look at, or you can get from practicing dentists the needs of various age groups. You should make a guess based on that. Of course, here you're talking about people who are on CSSA, but I don't think it's difficult for you to figure out the demand. You can't just based on what sorts of needs on the basis of the beneficiaries. You should be able to make a guess based on the overall situation in Hong Kong, on the need for prosthodontics. Well, or dentures, or removable dentures. Well, we know that there's a shortage of dentists in Hong Kong. And also, dental services are so expensive, and that's why we have this CSSA program. Even if we can get the data from private dentists, you can believe that the demand will be low based on those data because many people who have the need may not be able to afford it. So that's why I'm talking about extending the program to people who are eligible and who are receiving old-age living allowance. There's a separate program for giving dental service assistance for elderly. Shukachu next. I've noticed that for people living in private housing, who's actually who need support. Based on my understanding, those who are living in private housing, 60% of the rents are higher than the rental subsidy. It's very common. So if you ask CSSA households to make up for the shortfall, it's really not the intention of CSSA, as you know. So right now, I'd like to know how many of the beneficiary households are getting the subsidy which can cover their whole rent, and those who are aged from 60 to 64, how many of them are there, who are on CSSA, and how many can cover the whole rentals? And the community care fund is going to promote the launch a program to encourage CSSA recipients to look for employment for a 3-year period. By the end of 2018, there are 2,500 beneficiaries, but your photo only explain the situation of the 800 of them. So about the 1,900 remaining beneficiaries, what happened to them? Also, according to the paper, you're carrying out a review on the effect of the program. So let's know about the progress of the review of the program and whether you're going to continue the program and whether you actually regularize it to put it under the SWD. Okay, about the right now for the households receiving CSSA rental subsidy and who cannot have enough to pay for their rents, the current design is such that there won't be any household who would be able to pay 100% of the rent because the design of the program is such that the rental subsidy and the shortfall, that is 50% of the shortfall between the rent payment and the rent, that's used as the basis. And it's different from the initial design, which is a fixed amount of 2,000 or 4,000. So in that design, there are a number of household beneficiaries who may be getting subsidy which is higher than the rents. But the result is that for people who actually cannot cover much of their rents may be getting less subsidy than others who are getting subsidy more than what they have to pay in rent. So therefore, the revised plan is such that depending on the amount of shortfall, the subsidy will be offered accordingly. So now we're considering whether we need to make any more change. We need to wait to collect enough information before we review, if we were to regularize this item, what the arrangement should be. As for your other point about encouraging people on CSSA to work and the exemption of their wages cause them to exceed the level for maximum of 2,500 of waiver. I'm sure you understand the rationale behind it. Initially, our information shows that this doesn't quite reflect, the information doesn't quite reflect whether more people are doing more work. So, I mean, our study is going to be finished soon. We hope that by the time we finish the analysis, then we'll decide how we should go forward. It seems like the approach may not be that effective. We're still thinking whether there can be better alternatives. Thank you. Next one is UC Wing. Community Care Fund is designed to help people with financial difficulties and provide a social safety net. Therefore, is actually available to wide range of people. Since establishment in 2011, its surplus and fund has remained about $19.3 billion. So, considering the fund itself, is it that you don't want to use the original fund as much as possible? If that's the case, would that limit your guiding thought in relation to the use of the fund, because you don't want to use any of the 19.3 billion seed fund and only rely on the interest alone? Is that a guiding thinking behind? If not, then could you be more audacious and try to use the seed fund? And as for the support for rare diseases, there are several new items. With the new items for the support for rare drugs, would they be a regular support program, or would it be that after the only you will incorporate it into the Samaritan Fund after the pilot scheme? If that's the case, would it make the patients feel anxious? Well, as explained in the paper, Mr. Siu also asked us about the returns and interest from the fund. Right now, through the interest, as I said, it comes to $4.56 billion, and we have actually used $6.6 billion already. That is, we are using part of the seed fund already. Therefore, we are not limited by the return from interest in deciding or planning about how much of the fund to be used. It's just through exploration and views and information from bureaus on various pilot schemes that is community care fund would be used. So it's not because of our investment returns which would affect our considerations for support. So it's not about money after all on what we can offer. It all depends on the feasibility and value of the program. As for the rare drug or ultra expensive drug support scheme, the basic principle is that we should not, because of whether it's from CSSF to Samaritan Fund or to be paid by the government, the principle is that we should not affect the patients being helped by the drugs program. So how are we going to make it a regular assistance program? Of course, it will be through the HA and the Food and Health Bureau, which will look into the prospects. But for the CCF, before it's regularized, we will need to continue to support and offer the support through the drug scheme. We can't, see support for providing the drugs for the patients. Sometimes there could be changes in the clinical syndromes that require change of drugs, but that would not be because of whether it's funded by the Samaritan Fund, government, or CCF. So, Chairman, in other words, if a patient were to change drugs, then the mode of support would change. Is that right? Well, as I mentioned, I was just giving you an example, assuming that, just an assumption, that if a patient needs to use new drugs, or from a clinical perspective, he needs to change drugs, that will be left to the HA to decide from a medical perspective what drugs to be administered. From the perspective of CCF, we would not be involved in the medical evaluation, but we would have to rely on the HA to say if someone were to have a new drug or change drug, the HA needs to tell us that the drug would need to be put into our drug list. But the new drug may not necessarily have to be paid for by CCF. It could be paid for by other resources. Vincent Chen next. I'd like to ask about the pilot scheme on the purchase, on the subsidy to purchase and construct modular housing. So what's the progress so far? And secondly, I agree that the CCF can help with some pilot scheme in transitional housing. I just looked at the CCF website, you have 27 schemes in progress, but 26 of them have the details announced, but not this one, except this one, which doesn't have details provided on the website. Quite many of social welfare organizations and private developers are willing to offer land, and yet you don't have the details for us. Can you tell us more about what is the work progress of the pilot scheme? How can we make it more openly available? Because you have other support schemes like for people with severe disabilities, and you have subsidy. But then what about the details for this particular pilot scheme or program? Thank you. I think in implementing this program, of course, we need the support of the Housing and Trust Bureau, but the HKCSS is the one to implement it. But I think we could actually enhance provision of information. As for the Nam Chong Street scheme, my understanding is that in terms of, I think it is in the process of creating a tendering exercise for that benefit scheme. But we want to actually expedite it. I know that time is limited and there's a time period in which we can use the site. So we can see what more information we can provide. So, Chairman, actually, housing program has been going so well, but for this particular modular social housing scheme, I hope that in the long run you can actually hand this scheme over to the Housing and Transport Bureau. But if you can do more preliminary work to let the community know what's happening, then it will be easier for the Transport Housing Bureau to take over later on. If I were a private developer and have 2 vacant sites and I want to make them available for the scheme, then they need to know, what they should do, how they should approach it. So I think you need to be more transparent and provide more information. Yeah, if you were aware of any friends or individuals who have lands that could be offered for the modular social housing scheme, we very much welcome them to contact the Housing and Transport Bureau, and they can also contact the HKCSS, which is implementing the scheme.
For the Nam Chong Street project, the tendering exercise to construct modular housing is yet to complete, so we have to wait till it's completed. And when there is a population intake, we can see more information. If you can offer more details, it would be ideal. Mr. Roy Kwong. Good morning. Dental services are a problem for many people, so we certainly hope to benefit more elderly people. In the past, elderly dental assistance has been criticized due to a lack of publicity, and many elderly people did not know about the services. And the trade was also concerned about the tight manpower situation, and some elderly people said that they would have to spend the entire assistance in one go, so they were reluctant to use it, and that's why the number of beneficiaries were less than the government target. And you said more than 150,000 elderly people will benefit from the extended program. But after you enhance the program, how many elderly people will actually benefit, and will the problems I mentioned be improved? Chairman, the program has been in place for some time, and I realize that there might be a lack of publicity on our part, and this is something we can consider. And there were a lot of misunderstanding towards the dental assistance program. And like I said to other members, the focus of the program is to provide movable or movable dentures to the elderly people. As for relevant issues such as oral health, for services that supplement or are related to the movable dentures, then they would be provided. So we are not referring to generic dental services. The demand for generic dental services is obviously much higher, and our program only covers movable dentures, and we are extending the program because the provision of services cannot fill the need. It is not that we don't want to do more, but the challenge is certainly very real. We are lowering the threshold from age 75 to 65. How many elderly people can receive the dentures? We mentioned a figure of about 150,000. We are referring to the eligible population, but it does not necessarily represent the number of people who can have dentures installed. Some figures were cited from the trade, and lowering the threshold is certainly good news. And even if we assume that 150,000 elderly people are eligible, if many of them want to have dentures installed, has the government assessed whether there are enough dentists to provide the service? We expect to satisfy the demand, and we assess the number of dentists and dental clinics under the CCF who can provide the service. But as for elderly people who require dentures, they are likely to be more than 70 years old, and there might be less people aged between 65 and 69 requiring dentures. But as we implement the program, we would have a better grasp of the situation. Ms. Olin Chow, thank you. Item 18 of the annex carries details of one of the assistance programs, and that is subsidy for eligible patients of the HA to purchase specified implantable medical devices for interventional procedures, and 67 person times would benefit according to the paper, and 2 specified implantable medical devices are covered. I'd like to know what these 2 devices are. Hong Kong have a lot of kidney disease patients. So under the CCF, for kidney disease patients or patients requiring dialysis, how much support is given? I know some NGOs are providing equipment and services for dialysis, so I'd like to know whether the government will provide support and whether the support can be enhanced. Thank you. I will first address the second question. For the first part, I will defer to Dr. Koh. I've not heard any requests for supporting patients requiring dialysis, so I have to work with the HA. This is the first time we hear it. In the past 7 years, we have been actively listening, but this is the first time I hear such requests. So we will look at the situation. As for the assistance program number 18, I would defer to Dr. Koh to tell us more about those devices. These are interventional devices with clinical evidence and good efficacy. We are talking about coronary or heart devices. For example, for heart valve procedures, major operations were used to be needed, but with these devices, some devices can be inserted into the coronary valves, and certain devices can stop the backflow of blood. These devices are very expensive, amounting to hundreds of thousands of dollars, and they will be covered under this CCF. And the evidence or clinical evidence is preliminary, but we believe that they can help patients. As for dialysis procedures, we often use some blood dialysis or periodontal dialysis for patients suffering kidney failures. For dialysis patients, most patients would opt for periodontal dialysis, and support is already given. For patients who cannot receive peritoneal dialysis, blood dialysis would be used, and very often the dialysis centers will provide the support. But since manpower is tight, the support might be limited. So through the public-private partnership, and through PPP, blood dialysis services are provided, and so basically the HA will provide services. Dr. Fernando Chang. Under the CCF, there's a special subsidy grants for persons with disabilities, and this is for recipients receiving higher DA, and the age limit is 60. We were very puzzled about the limit because for the severely disabled, there should not be any age limit. But currently there are assets and means tests. This program was introduced in 2012. We have been calling for a cancellation of the age limit, but you failed to implement it. Can you explain why this only covers those under 60? We have explained it in the past. When this program was designed for those above the age of 60, for both PWDs and the elderly, we have community support services available to offer the support. So in this regard, there is an age cap. Dr. Chang's view has been voiced a number of times before, and I have explained it already. So as we regularize some programs, we would consider how we deal with the age limit. We are talking about cash assistance. There's a difference in support given to those above 60 and those under 60. And these services should be provided based on need, but not age. For long-term care services, this is the norm all over the world. You are saying that some existing services are available, and currently there are differences in these services and support given. So why are you stipulating an age limit at 60? I think I have been repeating myself. I have heard the views of Dr. Chung, but apparently he has forgotten what I said every single time. For services for those above the age of 60, there's a shortage in services. For PWDs and community services, developments are relatively recent, and the SWD and LWB will try to enhance the relevant services. The policy address also mentioned the enhancement of these services. So for PWDs, regardless of age, we hope that we can offer as much services as possible in the future. This is a cash subsidy. From past experience, we see that the use of the cash subsidy would depend on the situation. Well, there are a lot of insufficiency in the reply. For those PWDs, many people, well, 17,000 people are currently in the line.
According to the website, for the daycare centers, you have to wait for 12 months. For home-based care, including integrated home cares, you need to wait for 18 months. In other words, because it's age above 60, they have to wait for 1.5 years. And those who are under the age of 60, many would have to wait, of course. So why? I don't think we have enough time today. Services are inadequate, and yet you draw a line at age 60. Can you give us a written reply explaining why they're denied the service? Secretary, can you give us a written reply? So if we can have the answer in writing, then we will not forget it. Next one, Wu Chi-wai. Thank you, Chairman. 2 questions. Firstly, we mentioned about the elderly dental service program, whether it can be broadened has direct relationship with the supply. So have you sought to find out about the supply of dentists in Hong Kong? What is the basis you use to decide whether there's adequate supply or not? And also, from the supply perspective, whether the HA or government perspective, do you have plan? Does the government have plan to increase the supply to meet the social needs? I believe for elderly services among the elderly, there are various demand, and if you can intervene early, then you can avoid the elderly people having to wear removable dentures later on. I don't know whether CCF considers it, but there's a killer. Well, actually, there's a serious illness that caused the elderly people to go blind, which is the retinopathy disease. If you can screen early and to find out whether an elderly person has the disease, then the treatment procedure will be more effective and simple. If you wait till the elderly is at a late age of disease, then it will be more difficult to address it. The third reason, that is the main reason for the retinopathy disease. Do you have any plan to help the public examine the eye for potential diseases or tackle diseases at an early stage? Is it because of our lack of optometrists that really affect your planning for providing support for eye diseases through the CCF? Well, I try to answer part of the program question and see whether Dr. Cole can implement or supplement further for the retinopathy disease. For the dental service, well, correctly speaking, we are talking about a dental assistance in providing removable denture. Therefore, its coverage has to be narrow. But if you want to broaden it, then we are now actually making people age 65 eligible for it, down from 80. So that would have actually is intended to shorten the waiting time. We don't have any scientific ways or approaches here, but you know that people in Hong Kong, very difficult to really make an appointment with dentists because of limited supply. So the Food and Health Bureau is concerned about this. Therefore, in 2019, the HKU School of Dentistry would increase its student quota so as to increase the supply in the long run. As for the problem of AMD you mentioned, Dr. Ko, could you supplement? Yeah, for the AMD disease, over the past decade, treatment for it has really improved a lot. People can cure it by drugs, and the effects are very good. And CCF, however, is still trying to accumulating more information on the effectiveness of various drugs. But for the treatment of AMD, the clinical proof is very clear. Therefore, CCF has been providing the support, the cure for patients regularly. But for the drugs used to cure AMD, it has to be injected into the eyeball directly. Therefore, you need the help of optometrists to administer the procedure. In overseas, you trained specialized nurses can also do the injection. But in Hong Kong, as Mr. Wu you just said, we have a shortage of optometrists as well. We are now at a bottleneck. Still, the treatment of AMD is what we want to make further progress on so as to make drugs available to the patients for treatment purpose. Chen Chichun next. You all know that the CCF has two purposes. One is to plug any loopholes and to help people who slip through the social safety net. And also, secondly, is to test pilot schemes. So you want to launch programs that you're not aware or not sure whether a certain purpose can be met and whether it will work. If it turns out to be successful, then the pilot scheme could be regularized. And the programs could be folded if it is found to be not working. But I think another purpose is to provide some sort of buffer because of manpower or like shortage of dentists. It's not because you have money then you can get a dental support, adequate support, and therefore you are providing schemes or programs to meet the shortfall until adequate resources or manpower are available. I think for some programs, if it's being held back by monetary reasons, I hope you can really regularize them as soon as possible. And also you can do a proper review of pilot projects, like in paragraph 12 of the paper, where it talks about the pilot scheme for cervical cancer, and you're going to extend it to end of September this year, and so that people can have the third and second injection within a half-year period. But for the numbers, is it because of lack of publicity? By the end of 2018, you only use $42 million, half of the budget only. I know for the injections, they're expensive. You do it at the private clinics. The costs have doubled because of mainlanders coming to Hong Kong for the injection to prevent cervical cancer. I'm just worried that when the 3-year period is up and review is to be conducted, then what about a gap then? So if you decide to continue after review, that'll be good. But what about during the gap period? And people are turned down. If you're not giving the injection or the vaccination during the gap period, then that would actually pose even heavier burden to the society later on. Well, Secretary, supplement here. For the reason of extending the scheme is not because we haven't finished the review. Nothing to do with that. If you've noticed, in the policy address, it's mentioned that we're going to launch cervical cancer vaccination to primary 5 and primary 6 students. So it's about some sort of articulation here. And that's why we are extending this particular vaccination pilot scheme so that those who have the need can have the first injection before September this year. I hope that you can help spread the information so that young people and the parents can let their children to go for the vaccination. We are talking about 20,000 beneficiaries, which is lower than our expectation. I think it's because there are information, there's a need for accurate information to be conveyed to the community. Sometimes wrong information has been circulated, affecting the enrollment rate. But anyway, the government is going to launch the new program, so we hope to focus on primary 5 and 6 students. And that's why we want to extend this scheme so as to let overaged kids to be vaccinated. So this scheme targets families with financial needs. For those who can afford them, they can have the vaccination at private clinics. So in other words, that this scheme would end in the end. But still, there will be a group of people, a category of people who missed the scheme, who's also eligible, then they would miss out. Well, this scheme was launched in 2016 October. But thank you for the question. Maybe I hope that I can get more reports on this and so people know about it. And that's why for those who are in the appropriate age group, particularly those under the age of 18, young girls, to come for the vaccination. For people who are worried about it, they should look up the information. And let us take a balanced view here. When deciding on the program, the government, in this program particularly, the government fully believed that this could be helpful and help young girls avoid having cervical cancer. Well, I think I agree. Those who are eligible should really have the vaccination as soon as possible. Vice Chairman Hin. Thank you, Chairman. Justin the Secretary, in your answer to the question on the Nam Chong model housing scheme, you said that you can provide more information later on, and please let us know if you have them. If my understanding is correct, your view is that you want to see whether the Transport Housing Bureau can take it over. All along, I've been concerned about the functions of CCF. Nelson Chow, Professor Nelson Chow once said that the CCF is like Wang Tai-sin. Whatever the government cannot pay for, the CCF will step in. For the Nam Chong social housing scheme is like that as well. If you follow government procedure, the project exists $13 million and you will need to go for electrical approval. But if you were to subsidize HKCSS to carry out the scheme under CCF, then you don't need to go to electrical for support. I wonder whether the same thing will happen for similar schemes in the future. Like earlier this month, HKCSS launched a project in a modular housing project in Yemcheng Street. I don't know whether CCF is going to subsidize that. That project is even of a bigger scale than the Nam Chong scheme, up to $40 million in budget. I don't have much information about the scheme. I don't know whether the Secretary is aware of that. Under CCF, would you consider subsidizing that project? If you haven't thought about it, would you discuss it in due course? When? And if the CCF were to approve support for similar housing schemes, would they be public schemes? Would you provide papers to LegCo, to the PWSC, to let the public know about the budgeting and the overall plan? Would the cost be paid for by CCF or the organization itself? Well, thank you. In answering the other question, maybe I didn't really elaborate on this about the future development of a plan. As Chen Chi-chen said just then, the nature of this scheme is a pilot scheme, but there are also procedures, requirements, criteria that needs to be clarified, ascertained. So therefore, for the Nam Chong Street project, we think that This can really help various government departments focus their efforts and expedite the whole plan. CCF can only play the role of launching pilot schemes. In the future, it will be up to the Transport Housing Bureau to consider the direction for housing development. It's not that we want to use CCF to fund it to avoid coming to large scale. That's not the intention of CCF. It's just that we need time to ascertain the government's policy, the role that we should play under the government's policy for modular housing. Once a direction is there, is confirmed, then the government will be providing the funding to carry out similar projects.
You asked about the Yanchao Street project. I believe the Transport and Housing Department are exploring whether the CCF or other resources would be deployed. And timing is a factor we must consider. If a project has to be launched soon, it might have to come under the CCF. Mr. Michael Loh, thank you. I'm interested in two projects, including the dental services subsidy. The current subsidy is $15,000, and there are two age limits or age brackets. For 60 to 64, the requirement is mild to moderate handicap, and for those between 70 and 75, they have to be receiving OALA. Can you change the requirements so that those above 60 and receiving OALA can benefit? Apparently, the sound is coming from around me. So hopefully the Secretary can address this issue for the elderly people. It is very complicated. For OALA, the age threshold is 65, but here there are additional requirements, so you are confusing the elderly people. A lot of people do not know about it for this reason, and some of them do not understand how it works. So hopefully the government can do something by providing early dental services. You can really help the elderly people. Their living quality would be greatly enhanced. As for the assistance to elderly carers, one of the current requirements is 75% of the median household income, and you mentioned low-income families, whatever that is supposed to mean. These people are saving a lot of money for the government because they do not require institutional care, and their family members are taking care of them. So should there be no asset tests, you should not assign a coefficient of 75%. Many carers and organizations have to take care of dementia patients, but many cannot apply for a subsidy. So has the number of applications been lower than you expected? Thank you very much. We would like to further clarify the elderly dental assistance program. There are two phases. For the first phase, we targeted those age 65 or above and receiving community or home care services, and they have less financial means. There are different levels to the program, and the focus is to help the most needy persons. Eventually, we saw that relatively few people were receiving help, So the age threshold is 65 or above. So a person can be 70 or even 80. So we are we were targeting these users. The more a number of elderly people were receiving OALA. We are lowering the age threshold from 70 to 65. It will be implemented next month, if I'm correct. So the threshold has been lowered from 85 to 70 and then 65. So we have always been referring to OALA recipients and those receiving home care services. They would be informed by our outreach teams. As the CCF rolls out assistance programs, we have to consider the financial needs. Depending on the design and beneficiaries of these programs, 75% MMDHI is often used as a yardstick. If we are to regularize some of these programs in the future, we will consider Mr. Luk's views. Dr. Elizabeth Quad. Thank you, Chairman. For the cervical cancer vaccination pilot scheme, I realize that in her policy address, the Chief Executive announced that the vaccination program for primary 5 and 6 students would be regularized and this pilot scheme will cease. But as other members suggested, the number of beneficiaries were lower than expected. And originally, the beneficiary age bracket would be 9 to 18. In the future, it will be primary 5 to 6. I am fighting for a catch-up program in line with other countries. When regular vaccination is provided, girls up to the age of 18 can receive the vaccination. And usually it is conducted in phases. And in the future, you will transition to primary 5 to 6. I do not know whether this can be realized, but I'm doing my best. But if I fail, will the pilot scheme still cover CSSA or daughters of CSSA recipients above primary 5 to 6? The pilot scheme covered girls under the age of 18. So when we regularize it, we strive to see whether there were any deficiencies to the program. So we would relay your comments to the FHB. We are talking about very low numbers. Even if we promote the program, we are talking about just 20,000 beneficiaries. So through the discussion today, we hope that Sandry 1 schoolgirls can receive the vaccination as soon as possible. Like as Dr. Quad would know, some of these girls are new arrivals. They might be Sandry school students rather than primary 5 to 6 students. They might not be able to benefit. So hopefully you can do something soon, and hopefully within a few years, vaccinations can be given to all Sandry school students, including Sandry 5 to 6 students. So there would not be any loopholes. Since this pilot scheme, well, I find it unreasonable that the pilot scheme will not cover everyone under the age of 18. If this cannot be done, hopefully the CCF can do it. As for support for rare disease and cancer patients, apart from the subsidy threshold, we are also concerned how we can speed up the mechanism for introducing drugs. You said the assessment has been stepped up from once a year to twice a year, but this is still not enough. How can you further expedite the process? Again, I will defer to Dr. Ko on this part. Thank you. As Dr. Kwok suggested, we have stepped up the vetting frequency from twice a year to once a year, from once a year to twice a year. And like Dr. Kwok said, when a drug is introduced, we hope that it can be clinically applied as soon as possible, and we are trying to further speed up the process. And we would meet more patient organizations to find out about their needs. Apart from clinical evidence, we have to monitor the actual application on patients. So we will work hard on different fronts. Hopefully you can work even harder to bring us more good news. Thank you. Do we require a second round on the CCF? Mr. Wu Chiwai, I will draw the line here. Finally, my turn. Many members asked a number of questions about elderly dental services, the cervical cancer vaccination scheme, support for rare disease patients and the drugs they need. So when will these pilot schemes be turned regular? So the CCF aims to fill the void in certain programs. If that's the goal, the Elderly Dental Assistance Program has been in place for a number of years. Why hasn't it been made regular? So how many more years would we have to wait before it turns regular? For other programs, they might be only 1 year into a 3-year pilot scheme. But when we look at the subsidy amount or the number of beneficiaries, the difference is very wide. And this includes item number, program number 19, subsidy for persons holding non-local qualifications to conduct qualifications assessment, as well as the pilot scheme for women, low-income women receiving cervical cancer vaccines. And for we allocated more than $17 million for the pilot scheme for low-income women receiving cervical cancer vaccination. Is it that the beneficiaries do not know about the program, or do they have other doubts about the cervical cancer screening? And the program is only into the first year of a 3-year pilot scheme. If the progress has been subpar, it is hard to expect it to gather steam in the next 2 years. Is it due to a lack of publicity? As I explained, for the dental assistance program, a long time is needed because we have to assess the demand and supply very clearly, so that we do not create long queues all of a sudden for the elderly people. And on that basis, we decided to lower the threshold to age 65. Going forward, the FHB would consider the long-term arrangements. And after this exercise, we would have a better grasp of the supply and demand, and this would help us draw up policies and allocate resources. The chairman suggested low utilization for 2 programs. We will consider whether we can enhance the publicity. For the cervical cancer screening program, there is a lack of discussion in the community, and people usually talk about cervical cancer vaccination instead. Cervical cancer screening mainly targets grassroots women, so we might have to carry out more publicity, and we would work with the FHB and Department of Health. As for the subsidy for persons holding non-local qualifications, the demand is relatively unknown because it depends on the number of new arrivals in Hong Kong who require qualifications assessment. We do not grasp the information, so we would see if we can step up publicity. For the cervical cancer screening, the government should have information available on CSSA recipients or those receiving textbook assistance. You can attach the relevant information when you in your letters to them. Yes, we would consider that. Mr. Wuchiwai, second round, 3 minutes. Thank you, Chairman. I asked a question about AMD, and according to Dr. Ko, the HA has confirmed certain treatment plans that are effective.
My understanding is that for each dose, it's very expensive, ranging from $8,000 to $10,000. Do you have a plan to actually incorporate it into the HA's formulary for the HA to offer the treatment instead? If not, then it's like dental service for the elderly, for people with limited financial means. This could become an item for the CCF to support. Dr. Ko, could you answer, please? Thank you. For AMD, let me elaborate a bit. The treatment of it is such that the most effective is for the treatment of the drugs to be put on the formulary. But in some situations, since the drug can also be used to cure some mutations, therefore they may need to, if that's the case, then they have to be financed separately. But I can give you the details in writing afterwards because it can be quite complicated. So for the treatment, it could involve drugs that is to be paid for by patients and the other on the formulary of HA. I think the drug is incorporated in the regular formulary, but for some particular mutations, then other drugs may be required, which are not on the formulary. But Chairman, according to some media reports, HKU's School of Medicine's research showed that if you have loosened if you are paying for the drug, it can cost $8,000 to $10,000. That's quite costly. So my understanding is that if the HA were to make the drug part of the list on the formulary, I'd just like to confirm whether that's the case. If not, can the CCF, like in the case of removable dentures, providing support for people who need the drugs to help elderly people get the treatment for the third largest cause of blindness in Hong Kong? We do hope to provide support for the elderly, including AMD patients, through the formulary, HA drug formulary. Well, but if there can be regular support for it, can you, like CCF, consider this as a separate assistance scheme? Yes, I will. I think find out more about it with HA. We'll see what we can do. Thank you. So that's the end of this item. Thank you, Deputation, Administration. So now the next item.
咧就先
So let's invite the administration to come in. Review of the remuneration package for district council members. For this item, we have with us the Secretary for Home Affairs, Mr. Lau Kong-wang, and Director of Home Affairs, Ms. Janice Chair, and Assistant Director of Home Affairs, Mr. Howard Yam. Before the Secretary takes us through the paper, please be reminded that this item involves funding proposal according to 83A of the Rules of Procedures. Should members on this item have direct or indirect pecuniary interest, I'm sure you're well aware of this. I'm sure you know what to do. Before you speak, please declare your interest. So, Secretary, please. Thank you, Chairman. I'm here to brief members on the review of the remuneration package for District Council members. The review is done every 4 years before the election of the new term of DC members. In the past, we have consulted incumbent DC and talked to focus groups and also reviewed the expenditures of the current term of district councillors. And there's an independent committee which review all the information and make a decision. And the final proposal is actually approved by the Executive Council. So we're now going to review on what we're going to implement for the new term of District Council. And upon the request of DC on the transport subsidy and medical subsidy, as well as the reimbursement for winding up an office, we have tried to accommodate the DC views. So I hope that the new team of DC would follow the recommendations. Details are laid out in the paper. I'm here to listen to members' views. Thank you. Okay, members have raised their hands. Secretary, well, yes, we saw you. They include, according to order, Chen Wafeng, Lam Chut-ting, Lau Kok-fun, Kwok Pui-fan, Xiu Ka-fai, and Kwang Chung-yu. Right, Kwang, that is. We've got about half an hour left for our meeting. Each will have... Anyone else who want to speak? Well, each will have 4 minutes, including the answer. This meeting has to be extended by 15 minutes. Chen Wafeng first. Thank you, Chairman. I support the government's plan to improve district council members' remuneration package. I find that raising the DC members' remuneration and also abolish the 1/3 reduction in the non-countable honorarium for DC members who are also EXCO and ESCO members. I think that's enough affirmation of the work of the DC members. The public are having more and more demands for DC members. So I think that to increase the honorarium can help the DC members to be more flexible and be more devoted, engaged in their work in community service. Basically, in the end, it's the public who will benefit. Therefore, I support this proposal. But I also like to ask a simple question. In the past, all along, we've heard news about district councillors having abusive use of public money. So they're not really spending the public money on their work. Even though we're just talking about individual cases, nonetheless has a negative impact on DC's image. So while increasing their salaries, what measures do you have to monitor district councillors' proper use of public money to ensure that all public money is well spent? Thank you. I think what you mentioned is about the use of public money, and we need to be very stringent in monitoring it. Right now, there are two levels of work. That is, firstly, every month, the district councillors, when they claim for the expenses in each district, our district office has a secretary who will collect all the receipts, applications for expense reimbursement, and then they'll vet all the applications based on the current rules. It's a very stringent process. At times, some district councils think that we are being too harsh, but we need to strike a balance to monitor the use of public money while at the same time avoiding creating too much admin work for district councillors. So we need to we're trying to strike a balance. And on another level, district councillors are also public officers. They are actually governed by various legislations, including ICAC. So the law prohibits any abuse of money, public money, and they could be held to justice. Any follow-up questions? No? Okay, next one. Lam Chut-ting next. Chairman, first of all, declaration of interest. I'm a LegCo member and also a member of the Northern District Council. The latest proposal, on the whole, I think they actually, of course, are improvements of remuneration for district councillors. The role of DC members and their services are very important. Just look at the distribution of $4,000. If the chaos cost, if not, there is the help involvement from district councillors, the district offices will not be able to meet all the needs, even if they were to function 24 hours. In my office, district council office, they are actually helping the people and working till 10 in the evening. And we also even have to set up street stores to answer queries about the distribution of 4,000 cash handout, dollar cash handout. So you cannot deny the role of district council members. But for us who are also LegCo members or ExCo members, or who have two contracts, for some colleagues, who are my colleagues helping me in LegCo or ExCo, and they may have various contracts. And if we want to promote like a worker in district office to come to work in LegCo, but we need to renew a contract whenever a new post is offered to our staff. But now with the MPF offsetting arrangement, you have to deal with that sooner or later. In the past, the long service payment, the gap there isn't much difference. The people are not paying much attention. But now we need to discuss the MPF arrangement with any staff who are changing jobs. Now, in our case, they'll be working for the same employer if they were to switch from one like district office to LegCo, for example. So in the later days, if we were to lay off, if a district council to lay off staff, and staff who had worked at LegCo before being transferred to DC, or if they had been working in DC and then transferred to LegCo office, would their year of service be counted? Would the government recognize their accumulated years of service? Secretary or Director, please. Thank you, Mr. Lam, for your question. Based on our current proposal for a member's staff working in their office when they are laid off, right now our proposal is such that for the new term, there should be no ceiling to the compensation. That is, everything should be covered. But in the future, with the offsetting, the new proposal on the MPF offsetting arrangement, we need to see under the new proposal where there can be any shortfall in payment, and we will consider making up for the shortfall if that's the case. And as for individual case where staff need to be laid off, if the contract can satisfy the requirement in the proposal, then the compensation should be all inclusive. Well, Director, I've read your paper, but you haven't answered my question. My question was, say, in the first 2 years, a staff work in LegCo, like the contract states that she or he is working in LegCo, and but because of need, I transfer her to district council, and a new contract signed for employment for the district council. Then will her years of service in LegCo be included? If not, if it's not included now, you should really consider, because this person has not left her employer.
處長局長。
Can you consider this, Secretary and Director? For staff who have been on electrical contracts in the past, it would not be counted, but for exceptional cases, we would see whether there's room to afford alternative treatment. Mr. Edward Lau. Thank you, Chairman. I declare that I'm a district councillor and also a LegCo member returned by the functional constituencies. I'd like to thank the efforts of the Home Affairs Department. The director has invited district councillors from different camps, and focus group meetings have been held, and I see that Mr. Howard Yam has done a lot. After the paper was issued, I consulted a number of district councillors, and they generally feel that there is improvement in different areas. For certain areas, they have more suggestions. The enhancement will only come into force in the next term, and this is sensible because we're talking about enhancement issues, so it's reasonable that it comes into force from the next term. But for certain areas, for example, retirement pension, a number of members have been a district council for 6 or 7 terms, and their assistants have been serving them for a long time. They used to be very concerned because the closure of an office would mean $70,000 for the council, district council members, and this sum is not enough for experienced assistants. And that's why many people are happy about this enhancement. But can such items or such benefits that target members' assistants rather than members themselves can be implemented within this term? When a member decides to retire or does not want to be re-elected, they would have to pay long service payments or severance payments out of their own pockets for their assistants. So some experienced district councillors would like to know whether this can be implemented, and this is not in their direct interest. For the rents of non-PRH offices, and many members have to pay high rents in private properties. They might amount to $10 to $20,000. The accountable reimbursement is only about 14 or 15,000, and many members can only hire one assistant, and the burden is very heavy. So would there be any subsidy for offices that are not located within PRHs? Thank you very much. Mr. Lau asked two questions. First, whether certain parts of the enhancement can be implemented within the current term. Since funding for each term is considered holistically, so it is not possible to effect certain changes within this term. Some members have reserved fund starting from the first year to cater for various scenarios, and hopefully our enhancements can be implemented from the next term. In terms of rents, it can be allocated freely within the operating reimbursements. For those paying less rent, they can hire more people and vice versa, and it differs in each district. And for two straight terms, the operating reimbursements have increased drastically. So we will not make changes separately to the rental reimbursement. Dr. Elizabeth Quad, thank you. Apart from the rental reimbursement, I agree with Mr. Lau that for district councillors with offices not located within PRHs, they have to pay very high rent. If you don't offer them support, they would offer a lot less services because rent will become a heavy burden for them, and they cannot spare resources in other services. You talked about flexibility in deploying the resources. Well, no matter what, the budget currently only allows for one assistant. We lack manpower all around Hong Kong, and we hope to encourage more people to join as assistants. We have very limited money to pay for the assistants, and the annual rise is extremely low. And the work of the district councillors would become heavier. I think each member would at least need to hire 2 people to deal with our daily work. So in your review, can you consider that if we are to hire 2 persons or 2 assistants, let's say one is a fresh graduate and another an experienced assistant, $40,000 would not be enough. If you want the district councils to do more, for example, the $4,000 cash handout spelled very heavy work for us. If we can offer $10,000 or so, it is not possible to hire any talent. In terms of office rental, the situation in each district might be different. Some are located within PRHs, some in shopping malls, others in industrial buildings, and some share an office with electoral members. So there are different practices. As for putting a mandatory requirement on the number of assistants, each district council constituency is very different. For some constituencies, the area is almost 1/10 of the area of Hong Kong, while other constituencies might only cover a few public housing blocks. If we are to set a mandatory requirement on what they should do, it might not be appropriate. So at the end, if we offer an allocation for flexible deployment, it would be more suitable. I wasn't asking for mandatory requirement on the number of assistants who hire. I was saying that your budget should cater for 2 assistants if necessary. Based on reviews in the last 2 terms, in the previous term, the increase in the operating reimbursements were 34%, and 2 terms ago it was 15%. So you can see that there was a drastic increase in the operating reimbursements, including rental and salaries for assistants. Considering other reimbursements, well, there is a drastic rise. So at the end, we have to strike a balance. Mr. Petershield. Thank you. I declare that I'm a district councillor in Bremer Hill and also a electoral member. Paragraph 9 of the paper suggests abolishing the 1/3 reduction in honorarium for DC members with concurrent membership in EXCO and or LEGCO. So for members who are both DC and LEGCO members, they would only receive 2/3 of the DC honorarium. There are rumors that certain members will not continue as DC members, but these are only rumors. Well, even if I am no longer a DC member, for members who are both DC and LEGCO members, they have a very heavy workload in terms of juggling their time, but it does not mean that they would not take any one role lightly. If you only offer 2/3 honorarium for DC, it is not fair. It doesn't mean that they would only do 2/3 of their job. That's not the case. They would have to carry out their work 100%. Some people say that we cannot manage time. I think we are very hard pressed to do what we can. If people say that we cannot attend all DC meetings, which our honorarium should be docked. Well, even within LEGCO, very often we are in 3 meetings together, so it is hard to attend every meeting all at once. So for members with dual or even triple roles, this is unfair. And the fact is DC resources are not enough for the accountable reimbursement of $40,000. If you rent an office in a private property, it would not be enough. And for junior assistants, they only received $11,000 or $12,000. So where does their future lie? So there are very little resources for them. Well, if we want to do a good job, we would have to pay out of our own pockets. So for full-time district councillors, they have a very hard time. So if we are to nurture political talents, more resources must be given. Dr. Kwok mentioned that the reimbursement should cater for at least 2 assistants because of the increasing demand on DC members. I often receive calls at night and during the weekend, so our staff are under great stress. Some people say that certain parties might enjoy more resources. That might be the case, but apart from support from their own parties, the government is obliged to do more. For the 1/3 deduction, we agree with your view, but you should offer more support at the same time. The HAD plays a very important role in contributing to the community. Chairman, we are happy to address views from DC members. Well, some members told us that there was no traveling allowance, and we added that for medical allowance. We have changed the entitlement from 1 year to the next year. For weddings or funerals, well, they have a lot of money to pay. Does any member wish to speak? Thank you, Mr. Roy Kwong.
Thank you. Well, I'm a Yunnan District Councillor, and also while being a LegCo member. On the latest adjustment, I've noticed that you mentioned the abolishing of the 1/3 reduction, but I'd like the government to consider greatly enhancing the allowance for operating expense, because we rather hire more people with a passion for community work to serve the public. In the paper, it's pointed out that you want to add about 8% according to the price level in 2019. I'm lucky, I have to tell you, that in the housing, I am working in the housing estate where I grew up in, and the rental there's not that high. But for district councils working in private areas, the rentals are extremely high. I really rather you largely increase the allowance for operating expenses to promote more services rather than abolishing the 1/3 reduction in the non-accountable honorarium. Because I believe that many more councillors would rather you give them more budget to do their work. So would you actually be prepared to increase, or do you think it's possible to increase the allowance for operating expenses? Secretary, well, Mr. Kwong cited him as an example, and that's a good illustration. If you have an office in a public rental housing estate, then the rentals are lower and you have more resources to hire more people to help you. But for some other districts, the situation would be different. And it shows exactly that each district is different. We have a one-off budget for them to use for flexible deployment of resources. In this current DC term, there's been a 34% in the allowance in the operating expenses compared to 15% in the previous term. And the base amount for operating expenses is quite large. So if you were to increase the percentage more, then it would mean amount to a substantial amount. But I hope you understand that we need to strike a balance. Let me stress once again, each district has its own characteristics. I understand that this district councillors, if they could hire more assistants, it will be more useful to them. But after all, we're talking about use of public money, and the current proposal has been approved and considered by an independent committee. I think for the people who are not going to have the 1/3 reduction abolished, if they actually does not agree with our proposal, then you might wonder whether you should vote for these members with concurrent memberships. After all, for those who oppose, actually getting more, or who oppose actually not abolishing the 1/3 reduction. As I mentioned, the rentals in private flats are extremely high, and the rents would leave district councillors with little money to hire an assistant even. That's not ideal. If you want to nurture political talents in Hong Kong, to create a favorable environment for that, then the government should be really in touch with the real needs there, and to give district councillors the financial means to run an office. I think you should really move in that direction in reforming the remuneration package. Deputy Chairman, Au Dok Hin. I think the review, declaration of interest. I'm Southern District Councillor. In reviewing the package, I feel that you're not really looking at the key points here. I know there are a number of NESCO members, also district councillors, say that they would have the reduction in the honorarium abolished. But if the purpose is to give district councils more support, then we should have an overall review of their salaries. Look at overseas. Even though in each state or each constituency the number of the constituents or population represented is different, in Japan, in some prefectures, the councillors there would have a monthly salary of $40,000. In New York, a mayor or the municipal councillors will get a monthly salary of $90,000. I'm not saying that we should have as high a salary level, but in reviewing district council salaries, do some calculations. I don't know whether you will add this in your next paper. In overseas, municipal councillors representing the population he represents times the salary he gets, the amount actually will show a huge difference with that in Hong Kong. Our political development needs to really make reference to arrangements overseas. And secondly, about the hiring of assistants, in paragraph 2C, it says that for full-time, you are actually using the median monthly employment earnings of full-time employees who are clerical support workers for reference. In our case, our assistants don't just do clerical work, but they also have to meet with residents. They're like doing the work of social workers. So shouldn't you consider not just make a reference to the pay of clerical workers, but also look at other types of workers as your reference? And as for rentals, as mentioned by many members, I have a proposal here, Secretary. Would you actually use designated items or ask members to claim for designated items rather than just rents? Because in some places rents are so high, but in other districts rents are cheap. In public rental housing area, the rentals are high. In some private buildings, rentals are low, but in private buildings, rentals are high. You need to make sure that each district councillor can have his own office in his constituency. That would be better arrangement. What do you think, Secretary? Mr. Au gave 3 viewpoints. Firstly, I think about comparing with overseas countries, they may not be that appropriate. To be pragmatic, you need to look at the actual situation in Hong Kong. That's really a more practical approach. And just then you were comparing district councillors with municipal councillors in overseas. I don't know where there's comparing apples with apples. And also, I agree. I understand also, as for reference, district councillors' office do not just hire assistants to do clerical work. We are in contact with the district councillors' assistants a lot. Understand? And as for your points about rents, I've already answered other similar questions. To the next review, we can look at that. But today, if we were to have a breakdown for the rental expenditure, I think it may not be useful this time, or relevant this time. My other question, but before I do that, any members opposed to submitting this item to the FC for approval, because this is a funding proposal? No objection, right? Okay. Okay, no objection. Then now it's time for me to ask questions. Now, not talking about the details, I'd just like to mention that for the government to have a periodic review of the remuneration package for district council members and the practical difficulties faced, I think I agree with such a periodic review because society changes fast. Still, I'd like to say that even though we've helped a lot of residents in troubleshooting at the district level, but I personally also come across difficulties. As, for example, in relation to our offices, as mentioned, in renting premises in private buildings, financial pressure is high for those who have the offices there. In the last term, in the notable accountable expenditure, there have been adjustments made, but the problem still is that the increases are applied to all district councillors. So in the end, people think that well, people who are hiring or renting places in public rental housing, they only need to pay a few $1,000, and yet for those in working in private buildings, they have to pay more than $10,000 in rents. So you have to address the issue of difference in the rents. So is it possible that for those who are not working in public rental housing, as long as there are government buildings available, shouldn't you vacate some premises for district councillors to use as their offices so they have a choice that can rent a government premise at a lower rent so that they have a choice? It's up to them, of course. If in the end they prefer a more convenient location in a private flat, then that's the choice. And that would be fairer, to give them a choice. And secondly, about the accountable honorarium. My understanding is that if I were to use the non-accountable subsidy, if I use the accountable remuneration for electrical and district council, my provision for district council will need to be reduced by half. But that means that I would have less available. So as long as I claim in my district office that my own office that I'm also electrical member, I will have my budget slashed. That means I will have fewer resources to hire extra hands. So I think that's strange. Do you think that it's worth really improving on that kind of arrangement, making a change? And also for the setting up expenses, which will be increased from 100,000 to 120,000. That is for the first term council members. That's a help. But for us living in private flats, for those of us who will be forced to pay high rent when the contract ends, even though if I'm an re-elected district councillor, I still need to have new furniture or redecorate my old office. So it's the same expense as in opening a new office. So would you consider for councillors who need to move to a new office, can you treat them as not an re-elected but just the first term councillors who are moving location only? But I did have to pay out of my own pocket to move to a new office. So, Chairman, I'm going to ask the director to answer your second questions. As for rents in private flats, we have largely increased the overall financial support already in the past two terms. Of the 181 members, on the average, their rents in private buildings is about $10,000. So I think the operating expense of 40,000 should be enough to cover that. I know other individual offices which are particularly or very expensive, but they're not the norm. So we need to monitor the use of public money. Director, could you supplement? Yes, just done. We're saying it for re-elected district councillors. If they were to move their office, they will be treated as setting up a whole new office. So they will be paid for the setting up a new office. Yes. So even if you are re-elected and you were to move to a new office, you'll be given the reimbursement for a whole new office, setting up a new office. For say, for a electrical member who's also a district councillor, yes, for them they will need to have a reduction proportionally, but part of the reduction will be taken out from the district council, and another portion will be taken from the electrical provision. So we're just taking out from two sides because the councillor is wearing two hats. But director, I think I don't quite get your response. Are you saying that if I were to put my district in corporate, well, if I were a district councillor and an electrical member, then is the ceiling for the accountable honorarium be set at 40,000, or would that be slashed? Are you sure? That's okay. Your expenditure is the same, but your rents, of course, your office may show two titles. Well, from what I heard in the front line is that it's not that you have the provision slashed by half in each EXCO and LESCO budget, but now you're saying that that's not right. In a accountable reimbursement, we look at the receipts. If your receipts shows that you're not doing the work just for district council alone, we won't, because you're also electrical member, we won't slash your accountable expenditure by half.
Mr. Michael Look, thank you. I'd like to ask about the dismissal of assistants, and you said there is no cap on the reimbursement claims. The severance payments can be offsetted by MPF offsetting, but this is not mandatory. I know a lot of members who would pay the severance payments in full without any MPF offsetting. So I'd like to know whether the district councillors can pay the full severance payments rather than making any MPF deductions. To be honest, these assistants have served for a very long time. They have to do everything. They fill forms. They carry out various tasks, and many assistants have served the community for a very long time. By offering satisfactory dismissal requirements in the form of long service payments or severance payments, can the MPF contributions not be used for offsetting? After deducting from the MPF contributions, the remaining amount to be paid by the member will not enjoy any cap, but our intention is not for the employer to not deduct from the MPF contributions, because now the reimbursement is only for the difference. The idea is that we do not want to deduct from the MPF contributions. According to the MPF legislation, if offsetting is to be carried out, an application must be made to the trustee. Or let me put it this way. Since the government is abolishing MPF offsetting, can the government allow members to pay the severance payments in full? As for the long service payments, can claims be made? LSP is another issue. Some assistants have served more than 5 years. They have served a very long time, and they are retiring or they are being dismissed, and they are entitled to I wonder whether they are entitled to LSP. For the accountable winding up expenses reimbursement, these correspond to the current requirements for the employers under the law. The difference would not be subject to any cap because we are covering the obligations of an employer. As for the things not required under the law, and we would consider any changes, and we are considering the legal requirements for employers. What about LSP? Is that an entitlement? It depends on the year of service of the staff and whether MPF offsetting is allowed. When there is winding up of an office, there's MPF offsetting under the law, so it is about the difference. The LSP refers to staff with the specified years of service. Can LSP also be claimed? I want to confirm that. I would defer to Mr. Yam, Assistant Director. If it is not a winding up, but if an assistant retires before his or her term is up, what would happen? For LSP, that does not involve dismissal. It will not be covered by the cap, but it is covered under the OER. We know that there are plans to abolish MPF offsetting, so we would monitor the situation and see whether the abolishment of the MPF offsetting would increase the burden on members. And we will consider these in our review. Thank you. Would that be reviewed next time or this time? Next time? All right, so the question is answered. So that's all for the meeting today. I remind Mr. Look that you are yet to make a declaration. Well, I'm a Yuen Long District Councillor. My apologies. I declare that I'm an Eastern District Councillor and also a LegCo member. Any other business? If not, the meeting is adjourned. Thank you very much.